La tienes que jalar hacia ti. Ahí. Live. So we're live. Nice. We're going to wait for more people to join.
Okay.
Es que ya estamos. Es el número de usuario. So we're live from Verita Neuro in Mexico. We're waiting for some people more to join the live, and we're going to start this webinar. I think you'll find it very interesting. So I think we can maybe start with some things.
Hi, I'm Dr. Beatriz. I was born and raised in Mexico. I'm a specialist in physical medicine and rehab, and I have a major in spinal cord injury, neurological conditions. I studied in Mexico, and I'm one of the directors here in Verita Neuro Clinic. And joining us is also Dr. Rodrigo. Do you introduce yourself?
I'm Dr. Rodrigo. I'm also born in Mexico. I'm a physical medicine specialist, and I have a major on neurological rehabilitation too. So we're gonna start today. We're gonna talk about some topics. First of all, for the ones that don't know, Verita is a unique clinic in the Americas. We treat a wide range of neurological conditions, mainly spinal cord. And that's what we're gonna focus this live on a spinal cord injury. So we're gonna go through some topics. First, we want to mention the main conditions treated here in Verita. Then we want to go through the clinical aspects of the patients and the available treatments that we have. Then we want to talk about the expectations that patients can have when coming here to a treatment, the best time to come to a treatment too. And we're going to go through some questions that you may have. And in the last part of the webinar, we have a very special preview for you, a new treatment that we're going to bring to the Verita Neuro clinics. So let's start.
Well, who is this session for? Mainly patients with neurological conditions or their relatives and family that are looking for new treatment options, caregivers, maybe PTs, also doctors that are involved in rehab process in patients. And you can all be part of this realistic information. Sometimes not knowing what the clinic does may bring a little bit of doubt if the clinic is real. Even sometimes patients come and visit to see if it's real. Yes, it's real. We have different treatments, and we have the latest treatments.
So Verita Neuro has a very different approach on neurological conditions that other clinics in the world. And this is because we have a very, very wide and multidisciplinary team for treating the patients. So we don't do just a treatment, we do programs, and in the programs we include a lot of things. Like we try to treat the patient as a whole unity with not just the neurological, like the motor and the sensitive conditions, but also autonomic, bowel and bladder conditions, the psychology, also the things that may help the patients to have a best quality of life. So here in Verita, we treat with a multidisciplinary team. We have the best of the best. We have the best physical therapists here, the best PTs. They are majored in neurological conditions too, and they are the best of the world. We have the best medical team. We have the best surgical team. So we are very united and multidisciplinary team that can go through any medical neurological conditions. So in the programs, we can treat not just spinal cord injury, but we can treat traumatic brain injury. We can treat stroke. We treat cerebral palsy too, autism, and we have a program, a specific program for everyone that we make along with a medical team, with all the medical team.
Aside from all these conditions that Dr. Rodrigo has mentioned, the neurological conditions, any patient that has trouble with their independence and functionality in movement, for example, for walking, for balance, for grip or specific hand tasks, we also see them, even if they have different conditions. But mainly we see neurological conditions that have been acquired, not congenital, because those are the ones in which we can make a difference. So people very commonly ask, because they think that the clinic is specifically for spinal cord injury patients. No, this is not a specific clinic for spinal cord injury patients. Yes, this is the most kind of patients we get to see, because sadly, it is a condition that is increasingly in statistics. It is increasing every day for motor vehicle accidents and also because of violence, gunshot wounds. But we do see all these conditions that Dr. Rodrigo mentioned before.
So in this condition, as we mentioned, we treat a lot of stuff, and we have a wide range of treatments for these patients. So Verita Neuro it's very known because the use of the epidural stimulation, but we have a wide treatments for a lot of conditions. So as Dr. Beatriz said, we don't treat just spinal cord injury, even though it's our main treated condition. We treat a lot of other conditions. So if you have any questions about it, just let us know. Is there a question? Or we're going to go through the next topic.
Well, we'll try to be a little bit more effective. We'll try to divide into topics. We're going to start with spinal cord injured patients and what treatments can we offer. And maybe you are all very familiar that Verita Neuro has been one of the biggest bringers of the epidural stimulation. So I'd like Dr. Rodrigo, we can talk about the epidural stimulation. How does it work? Which patients can be in it? What are the realistic expectations we can have with it? And like the technique for the epidural stimulation, and then we'll be adding on other things.
So epidural stimulation, it's mainly what we do is place an electric device, an electronic device over the spinal cord, and this device can make people move voluntarily the lower limbs or the upper limbs again. So that's mainly it. We use that on spinal cord injury patients. It's first of all, it's a surgical procedure to place the device. After this surgical procedure, then we start a thing called mapping, which it's pretty much programming the device to each patient, because each patient has this neurological condition. It's an individual, very specific condition for each patient. So we start mapping. We have mappers who do that, and we start mapping every day to see how the patient responds to this device. And of course, a lot of PT. This is also joined. We also do stem cells during this procedure to enhance the outcome of the patients. And it's a 35 days program in which the patients stay here in the clinic with us. We have in every clinic we have suites where the patients stay, and then they can go to the PT or the programs in the sessions, and then return to rest a little in the suites. So we do this through our surgical team. The surgical team is the one that can perform the surgery. Then we start the PT and the mapping, and we have goals in each patient. We have some goals for programming this. So mainly what we do with the patients are to block the knees so the patient can stand up without any device in the legs, just maybe holding to some bars. We can do also a stepping program. This is not a device. This is not a program that would make people walk again, but they can take steps, and that we can do it with most of the patients with assistance. And of course, we have programs for spasticity, for pain. We can program a lot of things. And after that, the patients have to do a lot of PT at home. We suggest at least 6 to 1 year of PT, because after a spinal cord injury, the muscles are very weak, and we have to stimulate them and strengthen them throughout maybe a year. Yeah.
Constantly, patients ask if we were the creators of the epidural stimulation. We'd like to make clear that the epidural stimulator was created in the beginning, like 20 years ago, and used for pain matters. So Verita Neuro has had the most number of epidural stimulators located through surgery, but with voluntary movements, with mobility objectives. So as Dr. Rodrigo said, it is not like a magical treatment, or it's not a treatment, or it is not even a cure. And I like to be very clear in this, because sometimes patients, when we accept them to the treatment, they ask, should I bring my wheelchair? Yes, you should bring your wheelchair. You will always be a wheelchair user during the treatment. We don't know what will happen after the treatment and how far can you get. We know that we will get improvements, that we will try to accomplish all the expectations that we made during the consultation that we make via Zoom with the patient, but obviously this is not a cure. And the device, it has many renovations through the years, and it has different number of electrodes to make different programs, as Dr. Rodrigo said. But it is very important also to understand that the cornerstone of this treatment will always be the physical therapy. So the beginning of the treatment, of the new treatment, is the epidural stimulator with the surgery and the mapping that Dr. Rodrigo mentioned. But when you go back to your hometown, it is very important to keep on making physical therapy. You can even take pictures, videos here in our clinic when you're here for the 35-day treatment, or 55 if it's a double stimulator, in order to go back to your house and do the same things. You have to be in therapy at least for a year, so we can make sure that we are improving and accomplishing all what we said. Could you mention, Dr. Rodrigo, to which patients do we offer, besides the epidural stimulation, the LamiSpine and the epidural stimulation?
So that's a frequent question. The epidural stimulation is offered to patients that have spinal cord injury. And usually we do it with patients that with a neurological level between C5 and T11, maybe. So upper than C5, it's not useful for movement, and lower than T11, T12, it's no longer available, because the spinal cord injury usually ends in an adult. It ends in maybe L1 levels. So after that, below that, we have nowhere to place it. So those are the levels that we treat. We can treat complete or incomplete spinal cord injury patient. That doesn't matter. And LamiSpine. So LamiSpine, it's a method of delivering stem cells directly to the spinal cord. So what we do is a laminectomy. We take out a little bone of the spine, and then we micro-inject the stem cells directly to the spinal cord. So that can be made in it doesn't matter the level of injury. We can perform it in mostly any level of injury. So I think we have some questions.
Yeah.
So where do the stem cells come from? And is it from the patient? Okay, so we don't get stem cells from the patient because it would have to be another procedure. We have to go inside the bone, then take a bone marrow aspirate, and after the bone marrow aspirate, we have to send it to the lab. We have to process that sample, and we actually don't know how many stem cells would any patient can give us. So we use mesenchymal stem cells. We obtain the mesenchymal stem cells from Wharton's jelly, that's a tissue in the umbilical cord. And we do this because the studies in the world have shown that the difference between allogenic and autologous, that's allogenic is external stem cells, autologous is our stem cells. So the difference in the outcome is not different. So that's why we use it. We don't have to perform another invasion treatment or another invasion thing to the patient, and it's the outcome is pretty good also. So how do you cure complete spinal cord injury? Is it possible? No. So at the moment, we don't, in the world, we don't have any cure for spinal cord injury. That's not possible right now. We do have the treatments to try to, for the patient to have more functions below the spinal cord injury, but we don't cure. That doesn't exist right now. So any other? Oh,
Yeah. How do you decide which treatment plan is right for each patient and condition? Well, it's we do a consultation and a medical history, and we also ask sometimes for videos, also for studies like MRI, DEXA scan, and a video of the patient in his everyday life and also in his PT session. It is very important to know all the conditions since we are far away in Mexico and some patients are writing from the States, from Canada, from Argentina, from any other place. So we have to have ground expectations, not just making a wish list that the patient wants, but we have to be very realistic on what we can accomplish. Dr. Rodrigo, for patients exploring epidural stimulation or stem cells, how can you decide, or how can the patient know that they're taking the right treatment? And how can we decide as doctors which will be better? And I'd like you to focus on time frame of the injury.
okay. So so actually with epidural stimulation, we always do stem cells. But with the stem cells, we don't always use epidural stimulation. So you can come for stem cells treatment only, or epidural stimulation and stem cells treatment. How do we decide? It depends on a lot of things. First of all, it depends on the time frame between the injury and the time of the consultation or the treatment. So if patients are recently injured, like in a month,
Less than a year.
yeah, less than a year, then we usually do stem cells treatment before epidural stimulation. That's because the injury is very acute or subacute, and then the stem cells can have a lot more better outcomes in the patients with a functional outcomes. The other thing is the level of injury. So we talked about epidural stimulation being able between C5 and T11, maybe patients below T11 we do stem cells. Patients above C5 we can do stem cells too. And the other is if the patient is complete or incomplete. So if the patient is an incomplete patient and can do like standing and stepping, things that we are aiming to do with the epidural stimulator, then we do stem cells because it's not useful, the epidural stimulation, for them anymore. So that's basically it.
Okay. We have a question. Patient injured T7. He says that he does PT daily and he's searching for ES and stem cells. Do we think that he would have a good result? T7 is a very good level, but what determines this is obviously you're a candidate for epidural stimulation because you have more than 5 years with your injury, but until we don't have a consultation, we won't be able to say what we get our realistic expectations on the results. But yes, most probably you're a candidate for epidural stimulation and stem cells since you're a T7 level patient and you have 8 years of the injury. So yeah, it's very probable.
So we have another question. Is there a place where we can see experience from previous patient? Yeah. So what we usually do is you contact us, we do a consultation, and if you need it, of course, we can provide the contact of previous patients, other patients that are similar in the injury or the treatment as you would be. Always with the permission of the patient. So we ask the patients first if we can provide the contact to other patients, and if they say yes, of course we do that gladly. Is there another question?
Yeah. Can chronic patients be involved in the treatment for ES, Rodrigo?
Sure. So yeah, ES is for it doesn't really matter the timing. ES can be done in patients that are chronic or very chronic, so maybe 20 years. It depends mostly on the condition of the patient more than the time after the injury.
Okay. We know that the ES is let's say a costful treatment, and it also takes a lot of time consuming because you have to be here 35 days or 55 days in either Thailand or in Mexico, whatever you choose to go. But patients ask what can they do in the meantime. So it's very important, if you don't have the economic resources to come right away after your injury, that in the meantime, while you bringing up all these economical resources, you should work a lot in your PT, your mobility, trying to avoid any complications in the acute period, which are pressure ulcers. Try to get better with the orthostatic hypotension. Also trying to make a program for the urinary tract and a bowel program, and your trunk control if it's possible. If you come along to our clinic after doing this for a period of time before taking any of our treatments, that will be a big advantage whenever you come to us, and we will make a better treatment.
I think that one thing to acknowledge is that this treatment is it's a very intensive treatment. Patients undergo PT like four hours a day. They have to stay here 35 to 50 days. And we do very personalized programs. So as Dr. Beatriz said, if you can do like physical therapy, it'd be better for your outcome than if you don't do anything and then come to a very intensive treatment and then you don't maybe you don't get as much as you could get.
Okay, we have a question. I'll read the question. Dr. Rodrigo, if you want to answer it. I'm less than a year into injury at T6. I have recently been told based on my MRI that I have syrinx of 5 millimeter ranging from T3 to T12. So what can we do about that? If this patient can be part of our treatments or not? What's the step-by-step that he has to follow?
Okay, so there are two conditions here. The syringe is the first one. So we have to take a consultation on you. I can tell you that if the syringes have to be drained, then we have to do that prior to the treatment. And if it doesn't have to be drained, then you can come to the treatment. We'll have to see your studies and your case personally to give you a better answer. So I really don't know right now which one would be the best, like spinal cord or ES. We will have to go through your case particularly, but with a syringe, then we have to know with our surgical team if we have to drain that first.
Okay, and about eligibility for spinal cord injury, how can we tell as doctors that this patient will have a good outcome with the ES?
Okay, so it depends on several stuff. One, of course, is the timing. The other is the level of injury. And well, this we talked about. Then the other is age and condition of the patient, I think. So young patients can train better, so they usually have better outcomes. Young patients, I mean, 50-year-old, 40-year-olds, you don't have to be a 20-year-old.
And that they have been involved in a
Yeah.
physical therapy.
And they have been involved in physical therapy and they are physically active. So that's best. And of course, if the injury is complete or incomplete. So incomplete patients, when we do stem cells treatment, they tend to have better outcomes than complete patients because they have more neurological tissue to work.
Okay. Also, they're asking if a complete injury might become incomplete with our treatments.
Yeah, actually they have. Yeah. So it depends on the timing. The timing is like the number one here for coming to for being complete and becoming incomplete. So this is timing dependent, and as sooner as you come and do the stem cells treatment, then the more probable is that you can become an incomplete.
Okay, thank you.
Yeah.
On the comment that we just read, it says that it's a C5 patient. I understand that the C5 patient had the epidural stimulation, but they're asking if stem cells or something have worked to make hand function full. We do have a protocol that's called electrostimulation. It's very similar to the onward device. We follow this protocol for cervical patients, and we help them with their grip. Also, it's very important to know that, yes, we do have patients that are hand-abled for using fork and knife, to use it, making makeup for themselves, driving a car, making their hair, and doing intermittent cath by themselves or the bowel program, being cervical patients. And this mainly has been gained with stem cell therapy. Stem cell therapy, with its regenerative property, has helped with that. So it's not specifically the ES that has helped with intrinsic function in the hands. So that's very important. Can an old injury be treated? Yes, we have answered that question. And this is a very, very important question, Dr. Rodrigo. If walking is not the first result, what are the other meaningful improvements that people may notice?
Okay, so walking is not the main result, but you can gain motor function. So it's not the same, but people can start moving the legs voluntarily after the epidural stimulation treatment. So in function, that's really good. So if you don't move your legs and you start moving them voluntarily, so that's a big step. But there are a lot of progress too that doesn't rely on motor function. So one of them is bowel and bladder control. So those are with both epidural stimulation and stem cell treatment. So spinal cord injury patients know that bowel and bladder are the main issue there. And if you can perform better, then you'll have a better quality of life. So actually, one of our main goals is bladder and bowel. The other are autonomic functions like hypo or orthostatic hypotension. So that's very the treatment is pretty good for that. Patients with hypo orthostatic hypotension actually do pretty well after the treatment. We have had several cases of that. Then bone density, for example, people with a spinal cord injury, they lose bone density because they don't bear weight on the lower limbs. With the epidural stimulation, they can bear weights on the lower limb, and then the bone density can improve. So there are a lot of things beside walking that you can achieve with the epidural stimulation, and they can give you a better quality of life, like a real better quality of life.
Okay, so how do we decide whether someone should be only in a rehab program, stem cells or epidural? As Dr. Rodrigo mentioned, we're a unique clinic here in America that does not have physical therapy by itself. We only have programs, but it's not only programs with physical therapy. We fortunately here in Mexico, we do have a lot of physical therapist clinics, and also that they treat neurological conditions. But in our clinic, we always offer a regenerative medicine treatment or epidural stimulator or other different treatments or a combination of them, or what we're gonna discuss, the new treatments. Do you have any questions regarding spinal cord injury anymore?
So I've been paralyzed for 4 years. I'm complete. What progress will I see if I am at T6, but I can feel internal stuff? Okay. So it depends on which treatment or what treatment are you able to come. If it's an ES treatment, an epidural stimulation treatment, then you can, as we said, you can start moving your lower limbs voluntarily. Then you can bear weight and stand up with minimal help. Maybe you can do stepping. Your autonomic functions can be better. Your bowel and bladder you maybe if you feel some internal things, as you said, maybe that would go like really better. And it depends on how you manage bowel and bladder. We can do a program for that too. So it depends on it would depend on the consultation. In the consultation, we can really say, seeing your case particularly, we can really tell you what goals could we have with the treatment and what can you expect with it.
Okay, so before we move on to what we want to share, which is new here in Verita, I'd like to wrap up what we have talked about. Easy, how is it that you get involved in to have a consultation here, Dr. Rodrigo?
Okay, so through our website, you can go through our website. It's veritaneuro.com. Then you can put your queries and your name and
Medical
all your
form.
medical form there, and then you'll be assigned to a person that will follow your case, and that person will will give us your case, and then we'll do a consultation.
Okay, after the consultation, you'll receive an acceptance or a decline here, and with maybe a new consultation, or where we can discuss the goals of what you'll get in your treatment. What kind of treatments do we offer here for neurological conditions, Rodrigo?
We do stem cells, we do PT, we do acute programs for spinal cord injury too. We do epidural stimulation. That's for spinal cord injury, and then all the other neurological conditions too.
And for epidural stimulation, patients that can be involved for the injury level, which level the injury levels can be involved?
T5 to T11.
What time frame for epidural stimulation?
Doesn't really matter. It depends more on the condition of the patient than the time frame.
Okay, stem cell treatment, for who is it?
Stem cell treatment is for any neurological condition. Probably for stem cells is mainly for acute or subacute patients, less than a year. If it's more than a year, then we probably suggest the epidural stimulation with the stem cells treatment.
Okay. Do we cure neurological conditions in Verita Neuro?
No, I mean, again, this you have to have realistic expectations. We don't have a cure for spinal cord injury. The treatments that we do are aimed to enhance your function below the injury and give you better quality of life.
Okay, good. So any more questions regarding spinal cord injury?
Tell me about long-term hand recovery, and do stroke survivors see recovery in their hand? Okay, so yeah, again, stroke survivors, the answer is mainly the same as with stem cells and spinal cord injury. If this is an acute or a subacute case of stroke, then yes, the most probable case is that you'll get more functions in your hand, in your leg, in your speech. But if the patients are very chronic, like a decade, then maybe not that much. So we have to see each patient particularly individually.
We have another question, Dr. Rodrigo.
Does it work on level L1 complete injury? If we are talking about epidural stimulation, no, L1 is not able to do epidural stimulation. If we are talking about stem cells, yeah, that can work on L1 level. If we're talking about LamiSpine, yeah, maybe that too. It depends on the time frame and the conditions of the patient.
Well, I think that's it for questions for spinal cord injury. So we'd like to share with you that we'll be soon adding exoskeleton. So what is an exoskeleton? An exoskeleton is a robotic device which enables the patient to take steps. There are a wide variety worldwide of exoskeletons, but why did we want to add an exoskeleton here to the clinic? First of all, we've mentioned that epidural stimulation has a lot of advantages, both in the autonomic and the mobility area of a spinal cord injured patient, but it is not a must for walking or stepping. So we were very excited to go and look for new options of treatment. And this is mainly also a treatment, is a good not a solution, but a good option if you want to take something different, which is not a surgery. So could you talk about our new exoskeleton? What is it called and what does it work?
So the exoskeleton is the exoskeleton that we'll have is called ReWalk. The ReWalk is the only exoskeleton used not for walking, just for walking, but it can take steps. Climb stairs, and that's the difference. And it's a very, very good exoskeleton. It's a very functional exoskeleton too. it's mainly for walking and climbing stairs. So that's the main issue there.
That's what make it, that's what makes it unique. Instead of Exo, GT, or AL, or Cyberdyne, or Rocky exoskeletons, we're not saying they're not good, but we're saying or highlighting why would we choose to introduce ReWalk to our clinics, because it really makes a change in the person's life, taking steps, taking curbs, being able to be very independent using Canadian aid.
So that exoskeleton, the ReWalk has it works with a cane and with a kind of watch, so you can control the exoskeleton there. The other important and very important thing is FDA approved. So that exoskeleton, it's approved for walking and climbing stairs. And in the United States, that exoskeleton is covered by insurance too. So we use that exoskeleton here along with a program, a rehab program, and we can do a lot of things. It goes inside with the other programs that we have. So it's not just the exoskeleton; it's the whole program that you're gonna come along with the exoskeleton too. So, do you have any other question? No.
So we'll be bringing the exoskeleton late April, and we'll be training all of our team members from Thailand, from Dubai, from Mexico, and then we'll have the preview in videos, and you'll see the ads, and you'll see that it's a life-changing device. So, any other questions?
No questions? Okay, so we have another question. If you can feel internal things that mean you're incomplete, not necessarily. In the world, we use a scale. It's a clinical scale that's called ASIA, and the American Spinal Injury Association scale. And it depends more on the findings, on the neurological findings when we check the patient and explore the patient, more than the perception maybe of things that you feel. So you can be incomplete, but we don't know. So it depends on the neurological exploration that we do and the ASIA scale. Another question.
Interested in stem cell treatment for autism of a 6-year-old. Well, he's the expert.
Yeah. So we have treatments for autism. Usually we do between 3 and 12-year-old kids. So a 6-year-old can be a good candidate. So if you get in touch with our team, then we can gladly do a consultation, go through the personal med form and clinical findings, and then give you a program for that. Yeah, sure. Can the stimulator be switched on 24 hours per day? The stimulator can be switched on and off, and it should be switched on and off. It depends on your activity. Then if you want to take steps or bear weight, stand up, do some exercise, then you turn it on. If you, for example, at night don't want to do that, then you turn it off unless you have maybe a spasticity program that works at night for you to sleep better. But yeah, it could be it can be turned on and off. Yeah.
Okay, we have one more question, I believe. We get individual finger movement after cervical epidural stimulation C5 complete. As we said, the epidural stimulation works with voluntary movements from big muscle groups, not intrinsic hand movement. So we do that with stem cells and with a specific electrostimulation program, very similar to the OnWork protocol. We have it here, and it's not the epidural stimulation that works there. But yes, you get a hand grip. We do have studies on that.
You can get hand grip, flexion of the arm extension,
Biceps, triceps.
but like individual fingers, maybe not. Okay, so I think that's it. So one more question. We can take one more question.
In the meantime, we'd like to thank you for being here. This will be recorded. You can go back for the information that we gave you today. You can contact us at the address that Dr. Rodrigo mentioned. Send your reports, book a consult, and follow us so you can find out other patients' results.
So we are on social media, and we have a webpage, social media on Instagram and YouTube and Facebook, and our webpage is veritaneuro.com. Can a T67 dislocation fracture get treatment for spinal cord for stem cell injection? Okay. It depends. Yeah. So we're talking about two things here: the dislocation, which is an orthopedic issue, and the neurological stem cells, which is a neurological issue. So the dislocation, we don't treat it with stem cells. The dislocation has to be resolved with an orthopedic procedure. If it should be resolved, it depends on each case. If the dislocation produced any injury, any neurological injury, then we can treat the injury with the spinal with stem cells. Yes. That's it. Okay, so thank you for joining this webinar. We are glad that you are here. You joined. Remember, as Dr. Beatriz said, this is going to be recorded, and then you can go through it. If you have any questions, please contact us through our website or our social media, and we'll be glad to
Answer and get in contact.
Okay. Thank you very much, and we'll see you.
Bye-bye.
Bye.